Today we're going to be talking about osteoarthritis, which is a degenerative joint disease. This disease is going to be found in all sorts of mammals as well as other animals. Today we're going to be focusing, however, on cats. Here we're going to see a left lateral recumbency x-ray of a cat. We're going to break it down into where we can find this joint disease. First is going to be in the hips. The hips are going to have their ball joints. These are going to be able to be inflamed and experience this disease. Additionally, the knees, where the cartilage connects, the spine, additionally where the cartilage connects, and the hock has a rotationary joint that is going to be also able to get infected. This is also where the ankle is. We're going to break it down into its base words: osteo, meaning the bones; artho, which are relating to the joints; and itis, which is an inflammatory disease. So all three of those, it's a bone joint inflammatory disease. Osteoarthritis. It is a condition that causes the cartilage to erode, as well as for proliferation in the joints. Thinking of it as more of like a thinning of cartilage and a buildup of fluid with bony outgrowths around that. This prolonged breakdown will turn into more of an inflammatory reaction as it is constantly rubbing up against each other, and this is going to create chronic pain. Sadly, it is a chronic disease. It does affect felines once they start getting to middle to older ages. So for cats, it's going to be 7 to 8 years old up till the end of their lives. There are no way to reverse this, but there are treatments to reduce suffering throughout their lives, as well as to expand the length of their cartilage before it deteriorates. Some of the symptoms that we're going to find are decreased jumping and mobility, decreased range of motion. So these two are obvious as the joints aren't going to be working as well. Decreased exercise activity, and they will also be sleeping more. This is going to just come from the fact that your pet will be in a lot of pain. They don't want to move around, they don't want to be active, and honestly, it's easier just to sleep the pain away. And they are also going to become sensitive to petting and touch. Additionally, they are not going to be getting up or walking anymore, and they are going to be limping or changing their way of motion. There are two major ways to find the fact that your pet might be dealing with this. First, we will look at x-rays. X-rays are going to be radiographs of taking pictures of the joints using radiation. This is going to help to see which joints have been affected, as well as the extent of the damages that will be happening. And additionally, we have the synovial fluid collection and analysis. This test will be consisting of taking samples of that fluid with a needle and then evaluating what happened to the joint and seeing if there's any infection. Here we could see more x-rays, examples of x-rays that are going to be pretty helpful to see the joint issues. For this first one is a dorsal recumbency, so we're able to see more into the spine. This is going to be from the stomach inward, and we could be able to see the knees and the hip bones as well. Additionally, we have another version of that are more focused in the arms and the legs. We are able to see if there are any issues in the knees or the hips here. Then we're going to be more focused on the side of the bodies. This is also more of our lateral recumbencies, right or left. I'm unsure, but we could see the joints in the elbows as well as joints in the knees, and more issues in the hips and in the spine. These are going to be the best ways to view and understand what is going on and see if we can check if your cat has any osteoarthritis. And then here is just the needle that will be used for synovial fluid collection.